Hi all, welcome to video presentation on behavior challenges in children with autism. In this presentation, I will be discussing on some of the common behavior challenges that children with autism face, as well as some strategies for managing these behaviors. So before going into detail, let's see what behavior is. Behavior refers to anything that an individual does that can be described in observable and measurable terms. That means behaviors such as tantrums, happiness and aggression are not measurable or observable because they cannot be directly quantified. However, observable and measurable behaviors includes actions such as dropping on the floor, then laughing, smiling, etc. So by focusing on these behaviors, caregivers and therapists can better understand the needs and challenges of the individuals with ASD and develop effective interventions to address these unique behaviors. Next, let's see a type of responses that can help the children to achieve their goals. The first one is specific. We should be more specific when setting goals for a child. It's important to be clear and specific about the behavior required. This will help the child to understand what they need to do. And the second one is measurable. If you can't measure, you can manage it. So make sure that you can clearly define what success looks like for the child so that you can track the progress. And the third one is when setting goals for a child, that they should be very realistic and achievable. It's very crucial to establish objectives for the child that can realistically accomplish, as this will help them to maintain in their motivation and interest. So when working with ASD children, just keep in mind that the goals that we take should be clear and specific, measurable, so that we can track their progress, and it should be realistic and achievable. Next, when setting goals or expectations of a child, it is very important to focus on no more than 3 behaviors that are relevant. This will help the child stay focused and motivated, and ensure that there is a time limit so that the child has something to achieve within a fixed period. And this will help the child to stay on track and work towards their goals. Next is the type of behaviors of the child. There are 2 types of behaviors. One is skill behavior and the next is a problem behavior. So the performance of the child depends upon these 2 behaviors. And the skill behaviors are motor skills, that is refer to motor skills and activities of daily living such as eating, bathing, dressing, grooming, brushing, etc. And these behaviors are essential for a child's independent living. And some other specific skill behaviors are: one is language, which includes both receptive and expressive language skills, and these skills are essential for effective communication and social interaction. And the second is reading and writing, which is another crucial skill behavior that enables children to understand and express themselves in written language. And the next is the ability to understand and work with numbers and time, which is essential for the daily living and academic success. Children also need to develop domestic and social skills such as self-care, household chores, social interactions to become more independent. Finally, pre-vocational and money skills are also very crucial for the children to acquire, to prepare them for employment and financial independence. So by focusing on the development of these skill behaviors can help the children with autism reach their full potential and lead fulfilling lives. Now let's see what problem behaviors are. Problem behaviors are which interfere the child's ability to learn and function in daily life. It can be defined as any behavior that is considered to be dangerous to oneself or others, inappropriate for the child's age or developmental level, interferes with child's learning, and which is socially unacceptable. Problematic behaviors include like physical aggression, self-injury, property destruction, disruptive behaviors and non-compliance. And these behaviors can have a significant role in the child's ability to learn and interact with others. By identifying the specific behaviors that are problematic and understanding the responses behind them, we can develop effective strategies for modifying those behaviors and create a more positive learning for them. In order to effectively address problem behaviors in children, it is important to first understand what they are. Some common types of problem behaviors include pushing, punching, then kicking, biting and scratching, etc. Hyperactive and impulsive behaviors like difficulty sitting still or waiting for the turn, elopement where a child leaves a situation that can be dangerous, and disruptive behaviors like screaming, showing tantrums, non-compliance can also interfere child's learning and socialization. And another one is destructive behaviors like damaging property or the environment, and withdrawn behaviors where a child refuses to respond or interact can make it difficult to engage with them. And like stereotypical or self-stimulatory behaviors like rocking or repetitive vocalization can be distracting. And other self-injurious behaviors like head banging or biting can be dangerous to the child themselves. Finally, fears can cause significant distress and anxiety for children. By identifying and addressing these behaviors, parents, caregivers and educators can help the children to develop more positive and healthy behaviors. These challenging behaviors can be caused by a variety of factors, like individual differences such as temperament and personality can contribute to challenging behaviors. The family environment, including parenting style and family stress, can also have an impact. Impairments and disabilities such as autism or ADHD and environmental factors such as living in poverty or experiencing trauma can also play an important role. Physical factors such as sleep deprivation or illness, or psychological factors such as anxiety or depression can also impact in this behavior. So it's very important to consider all these factors when working with the individuals with ASD who exhibit challenging behaviors. When dealing with challenging behaviors, it is important to consider all the possible causes, and one important cause is the medical cause. It's very important to check with these questions. For example, do they have any infection or toothache that could be causing this discomfort? That is, pain can also lead to behaviors that may be challenging. So it's very important to consider medical issues as possible cause and address them accordingly. Then next is about seizures. Seizures can sometimes related to challenging behaviors. So if you notice a child exhibiting behaviors that seems to be more problematic, it's important to consider that whether a seizure could be the culprit. Now, another area of focus is on sedation or polypharmacy, which means taking too much of medications or multiple medications. If the children seems excessively drowsy or lethargic, it is worth asking that if they are sedated or they are taking too many medications. Also, you can check does the child get enough sleep, or does the child is allergic to food, or other dental concerns like, for example, tooth pain or dental issues can also cause irritability. So you can check with these questions like, when was the last dental exam, is there any tooth pain or discomfort? All these things can pinpoint the issue and lead to effective interventions. Another thing is genetic conditions that may be another potential cause of challenging behaviors. That is, some genetical conditions like Fragile X syndrome, Down syndrome, Lesch-Nyhan syndrome and other can result in challenging behaviors. Therefore, a thorough assessment of the individual's medical and family history as well as consultation with medical professionals can help determining if a genetic condition can be contributing to the challenging behaviors. Like genetic factors, there are some other mental health issues can also become a cause for challenging behaviors that include anxiety, depression, OCD, etc. Then cognitive disabilities can also play a significant role in challenging behaviors. Understanding an individual's cognitive abilities is very essential when addressing challenging behaviors, can help to identify the best course of action to support their needs. Next is communication difficulties. It's another potential cause of challenging behaviors, and it's very crucial to evaluate an individual's communication system when addressing challenging behaviors. That is, communication challenges can lead to frustration, anxiety, misunderstandings, which can contribute to challenging behaviors. So with the help of a speech language pathologist, we can identify and develop appropriate communication interventions to support individuals with communication challenges. Another possible cause of challenging behaviors could be sensory dysregulation. So it's very important to determine whether the behavior is due to a response to a sensory overload, or whether there are significant reactions to environmental factors such as loud noises. So by considering these, it may be possible to better understand and manage challenging behaviors related to sensory dysregulation. So these are the causes of, like we have mentioned, genetical factors, other physical, psychological, social factors. Now we are moving on to environmental factors. So challenging behaviors may be caused by environmental factors such as location, time of day, setting, activity, etc. So when considering potential areas of focus, it's important to examine these environmental factors. Additionally, it is important to determine whether a particular task is beyond their abilities. Challenging behaviors can be caused by environmental reinforcement also, which means that behavior is being reinforced by something in the environment. So when trying to address these behaviors, it is important to focus the response of the family members, staffs, educators or caregivers to the behavior. So we can check like are they reinforcing the behavior by giving it more attention or removing a request. By identifying and changing these responses, the child can be encouraged to engage in more appropriate behaviors. So by doing so, child can be provided with more positive and effective reinforcement to shape their behavior and foster long-term positive outcomes. To effectively address challenging behaviors, it is important to first understand the purpose or function of the behavior. There are two main functions of behavior. That is, one is behaviors to get something and behaviors to get away from something. So behaviors that seek to obtain something can include attention-seeking behavior or request for tangible items. On the other hand, behaviors that aim to get away from something may include avoidance or escape behaviors such as leaving stressful situation or refuse to engage in a task. So altogether, we can say that behavior is also communication. So children, they are trying to communicate something through their behavior during every moment in every day, and even if they are not aware of it. So a child's problematic or inappropriate behavior is a sign that he or she is upset and that something is not right. Thank you.